Some patients have different problems with their hair than others, and particularly there can be some ethnic differences. Thinking about African American patients, their hair doesn't always grow straight the way a Caucasian patient's hair will grow. African American patients frequently have kind of spiral growth, and it's exactly the way it grows. Like a corkscrew, the hair will grow and turn as it comes out of the follicle, even as it's passing through the scalp. And that creates special challenges for doing restoration procedures. You usually have to use a harvesting tool. It's a little bit wider diameter because you need to take a tiny bit more scalp with the hair follicle to make sure that you're not cutting through it, because it's hard to tell the exact direction of where the follicle is sometimes. Because of that turn of the hair as it grows, you might not really see what direction the follicle is inside the scalp. So you have to take a little bit more scalp. The good news is that when you place those grafts, the spiral growth tends to cover the scalp better. So the darker hair growing on the scalp will cover the scalp, and the fact that it kind of curls around in an irregular way will cover more scalp than a hair that just comes out and grows straight, because you see more hair as it's growing in that curly direction. There are some other differences. The amount of hydration that the follicles take can vary from patient to patient. There can be different thicknesses of hair, some hair growing thicker or thinner. It can also influence what the results are like. So it's important that you find a doctor that's going to have the experience to know the differences, because African American hair is a little different than Caucasian hair in ways that can affect a hair restoration.